If you've been to Riverbanks Clinic and you've just had a mole removed by CO2 laser or radiosurgical techniques, this video is going to explain what to expect in the healing period over the next few days and weeks. First of all, you will have had some antibiotic ointment applied to your wound where the mole was. This acts as a barrier because it's an ointment, it's got some Vaseline in it, and also it's a prophylactic against any infection. There's an antibiotic in there called chloramphenicol, and what that will do is help prevent any infection from developing. The chances of infection are incredibly low even without the antibiotic. So we are just being super careful here and to ensure that you don't get an infection. During the first 2 days after procedure, I would like you to keep the wound dry. If you have been given a dressing, please leave that on. If a dressing has fallen off, do not worry. Just apply the ointment instead, and that will act as a barrier. After the first 2 days and you've still got the dressing on, you can take it off and apply the ointment 2 to 3 times a day. I want you to do that for the next 5 days. So you apply the ointment for 5 days, starting 2 days after the procedure. You should notice that the wound gets drier during this time, but it will still get a bit red. That's a normal inflammatory response, and an inflammatory response is where your body's going to start healing itself. What isn't normal, and when you should contact the clinic for some advice or a checkup, is if after about 3 or 4 days it starts turning green or more painful than what it was. Then perhaps we should have a look. In the meanwhile, if you do notice it's not healing, and rather than it getting better, it's getting redder and redder after a few days, you can try bathing it with salted water. So in other words, if you put a teaspoon of salt in a cup of warm water, so freshly boiled water, but make sure it's not too hot, and just to make sure that's dissolved. And then what I'd like you to do is use a cotton bud to dip it in the salt water and dab it on the wound. If you do this 3 times a day for 2-3 days, that should remedy the problem. Now, once the wound is dry and the scab has formed, it's safe to apply makeup over that. Do not apply makeup until the scab is dry. Then the scab, you can wash normally. The scab will heal just like any other cut on your body has healed in the past, and you will find that over a week or 2 that scab will naturally fall off. The wound will appear pink still for a few weeks before it returns to normal color. Now, depending on your skin type, lighter skins, it will stay pink for a few weeks before returning to normal skin color, and darker skin types, it may go darker for a few weeks or months before it returns to normal skin color. If the hyperpigmentation, or in other words, the darker skin, stays dark for too long, please let us know and we can offer you a prescription cream that will help fade that back to normal skin color for you. Now, if you've had some stitches put in for a excision biopsy or a cyst excision or a mole excision, these will need to be removed between 5 and 14 days after your procedure, and you would have been informed that at the time of your procedure. Please care in exactly the same way. So in other words, keep dry for 48 hours, apply the ointment 3 times a day for 5 days, and then you can wash normally after 48 hours. Please make an appointment for your nurse to remove the stitches. We offer that here at the clinic, but if you can't make it to the clinic, your GP's practice nurse would be able to do that for you. Sometimes I would have used absorbable sutures, and these will naturally absorb after about 6 to 8 weeks. In the long term, sometimes the healing process doesn't switch off when it's finished. It carries on healing. Your body carries on laying down new collagen. And this is where you can develop complications such as a hypertrophic scar or a keloid scar. If that is the case, please come and see the clinic where we offer some solutions for such complications. Now, in some instances, the mole may start to recur, and this normally happens in about 6 to 8 weeks following the procedure. That usually means that a tiny bit of the mole has been left behind, and we didn't want to go too deep at the time of the procedure because we wanted to minimize any scarring risks. If the mole has started to come back at about 6 to 8 weeks post-procedure, please book in for a top-up procedure, and there is a small fee for that, which would have been explained to you at the original consultation. If you have any other concerns or questions, please message the clinic or call the clinic or book an appointment for a review. And if you like this video, please press the thumbs up. Do subscribe to our channel for more aftercare instructions and other information about treatments. And if you've got any comments, please do post them in the comments below. Thank you.